Well, thank you everybody for attending today's program, and we're going to focus on peri-implant health through the visual diagnostics of using the QBLISS equipment. And I really want this to focus on kind of live clinical situations, how we integrate it, the workflows that we use in our office to actually prevent peri-implant disease. So we're going to talk about using the QBLISS, the fluorescence-based imaging, and how that helps us to detect the risk earlier, explain it more clearly to our patients, because now they can see the areas where disease is most likely to occur. And then we'll talk about how we can integrate that into our practice to monitor the patient's health as they go on with time. So the program outlined, the three main points I want to talk about is just talk about the incidence of peri-implant disease. We all know that it is fairly prevalent today. I want to talk about biofilm identification and how we use that equipment to educate our patients on the importance of biofilm and their implant health. And then on the point number 3 is I want to talk about what we're doing today to help prevent peri-implant disease and not just let it happen. So there's a lot of steps that we are using in our office to be a little bit more proactive about this. And I think that's the important part, because this equipment can do so much, but how do we apply it clinically? And that's really where I want to focus on today. So I want to go through what the incidence of peri-implant disease is, just to kind of put some emphasis on why we're covering this today. And have been many studies done. Some of the percentages vary, but what we know today is that there is a need for uniform diagnostic protocols. And I think one of the easiest ways to show patients the health of their implants or the tissue around their implants is using the QBLISS technology. So we need diagnostic protocols, so we'll talk about that. And then we can target ways to prevent the disease from progressing, because we know with an implant, once the disease starts, it's very hard to treat. So some of the estimates say that about 46% of implants will develop peri-mucositis within 5 years, and up to 1 in 5 patients may develop peri-implantitis. So again, these percentages are very high, and we don't like that. So these estimates can vary, and I think it depends on how during the study what the case definitions are. But there's an important conclusion that we need earlier detection and then better maintenance communication, because at least in the United States, the patients, when they have implants placed, they're making a fairly large investment. And although we know that it doesn't necessarily mean that it's going to last forever, an implant, our patients kind of expect that. Oh yeah, and I just saw a little pop-up. I just wanted to emphasize, because we have a lot of viewers from all over the world that honor us by watching this program. And Hannah and I were talking about this, that there is a way to translate. If you go into the options, which are the 3 buttons at the bottom of your screen, and you go into settings, you can adjust the captions to actually translate to different languages. So I just wanted to point that out. So one of the things that I do in the States is I'll do implant surgeries for groups. And this one we did a 8mm sinus lift. But when I place an implant, what I want is I want healthy integration of that implant. And I don't want that implant to develop peri-implant disease. And one of the things that makes this very difficult, whether I place the implant or somebody else places the implant, when the patient comes into my practice, a lot of times we'll look at an implant and they have peri-implantitis, but it doesn't hurt. It's kind of this silent thing that's going on in their mouth. And then we see the visible breakdown of the bone or the inflammation of the tissue. And all of a sudden we go, okay, now we've got the situation where we have to figure out, can we maintain it? Can we treat this area? Or are we looking at that implant having to come out? So one of the things about peri-implantitis or peri-implant disease is very oftentimes it's very difficult to see, and it may not cause any kind of discomfort. And then when you get this, where you're starting to lose bone around the crestal bone around these implants, we all feel bad. Was it something that we did as the surgeon placing the implant? Is it maybe the implant? And that's why I think there's so many implant designs, because everyone has an excuse for why implants don't do well. Or, worse yet, maybe we blame the patient because, they're not keeping that area clean. But all of this, once we get to this stage, now we're reacting. We have disease, we can identify the disease, and now we have to react to figure out how do we treat that disease. But what I'd like to focus on today is how can we use QBLISS to prevent this type of disease state from occurring? Because when the bacteria gets underneath the tissue, the soft tissue, these implants are just a very difficult area and structure to try to keep clean. There's the threads of the implants. A lot of times they have a surface treatment to make them a little bit more rough to get better integration of the bone. And so if we see this, it's very hard to remove that biofilm that's gotten into these deep pockets and into these osseous defects. And what do we tell the patient? They can't brush down in these areas. They can't floss in these areas. And so one of the things that we've emphasized in all these programs that we've been doing about QBLISS is, again, I think the dental industry got things wrong. We've been very reactive in our industry. We wait for disease. We look at our radiographs and we see a cavity, and then we go in there and treat that cavity because the insurance has kind of trained us to be that way. If we want to get compensated for doing that filling, we have to be able to show the insurance company that there was a cavity. But I think today patients want something different. They'd rather stay healthy and not get into a disease state that then has to be treated. And in order to do this, we have to prevent the problems from occurring before they do. So the QBLISS, I think, helps us to identify those areas where disease is most likely to occur, and then really helps us quickly communicate this to our patients so they understand what it is that we're looking at and what it is that we need to treat. And then we can get into what I call dentistry 2.0, which I think is the future of dentistry, and that's being proactive. Even in restorative dentistry today, we have ways to prevent decay. If we see early signs, we can prevent demineralization. If we see early signs of gum disease, we can prevent that from progressing. So I think we're in this very unique and exciting time in our profession. So one of the things about biofilm is I think biofilm is something that we all know about, but we don't really understand. I was telling Dr. Yoon, I'm teaching an occlusion course this weekend. It's a 2-day course. And it's funny because all of our dentistry relies on how we develop the occlusion, the forces that our restorations or the teeth are subjected to. And yet many of our clinician colleagues don't understand a lot about occlusion. And biofilm is something similar. What causes decay? Well, it's biofilm. What causes gum disease? Well, it's biofilm. What causes peri-implant disease? Biofilm. And yet many of us know the word, but we don't really understand what it means. So biofilm is that living community of microorganisms that attach to the surface, and then it begins to mature. And as it matures, it's harder to remove. It's harder to treat because it creates its own protective matrix. And like a community, all that bacteria begins to communicate and support each other. And this is the pathogenic bacteria that's going to cause that disease state. So in the mouth, we're going to get biofilm, but there's going to be two types of biofilm. There's more a symbiotic biofilm and a dysbiotic biofilm, one that's going to be pathogenic. Our goal is not to necessarily remove all the biofilm. There's some good biofilm there, as I mentioned. But what we want to do is we want to remove the pathogenic biofilm or not allow it to develop, because that's going to cause the disease states. So we have the good biofilm that exists. It's kind of like in a rainforest community. You have the foliage, you have all the greenery that's growing, you have all the wildlife, and it all supports each other. But it's all very healthy. So the characteristics of this type of biofilm in the mouth is it's going to be a very diverse microbial population. It's going to prevent the overgrowth of the pathogenic types of biofilm, and it's going to cause a very low inflammatory response. So you've got this healthy biofilm that's in the mouth, and we can leave that there. And over time, if we don't control it, we get the dysbiotic biofilm, and this is what causes the disease. This is just like in that rainforest example where now you have some invasive species that comes in and just throws that balance off. And now we're going to have chronic inflammation, which can cause that peri-implant disease. We're going to get that tissue destruction. And so what we want to do is we want to control the environment around our implants, around the teeth that where there could possibly be decay. And that's why the age of the biofilm matters. And so again, with our QBLISS technology, we've talked about this in past programs, is that if we shine our camera on the teeth and that light hits the teeth and we see red, we know that that's the older, more mature biofilm. So that's going to be more pathogenic. That pathogenic is going to have a thicker matrix. It's going to be more resistant to antimicrobials. It's just going to be more mature. And that's what we don't want to have develop. So how do we communicate that to our patient? Because this is a case where underneath the bone, you can see we have bone loss. So we have peri-implantitis. The patient has no pain. The patient, if they do follow any kind of oral hygiene regimen, it doesn't have a lot of bleeding. They don't have a lot of inflammation in that area. So how do we communicate the importance? We see that these implants could just fall out soon because we know that large osseous defect and that the difficulty of keeping that clean, that this is going to progress, and it could progress at a very rapid pace. Well, if I take a white light image of this area, again, the average patient looks at that and it doesn't mean a whole lot. When we look at this area, we can see that, oh yes, there's a lot of plaque developing in that area or collecting at the gum line. And we know that's not good for these implants. But now when we use our technology and we can create that red glow, and we just explain to the patient, red is bad. Red is where we have this mature biofilm or bacteria, and that bacteria is the bad bacteria. That's a pathogenic bacteria, and that bacteria is going to cause inflammation around the gum tissue. It's going to cause chronic inflammation or infection of the bone. We're going to lose bone, and these implants are going to fall out unless we can do something to treat this. One of the big things is you're going to have to really be really good with oral hygiene. And I will tell you, in this patient's case, that's going to be very difficult. The patient's manual dexterity is not the best. Vision is not the best. So this can present a problem. But the nice thing is we have this documented. And then you look, and we've done programs about this in the past too. When you look at the restorations and the cracks in the restorations and the red glow in those cracks, we know that these are starting to become very large cracks, and there's biofilm developing in those areas, and that's why it's starting to glow red. Being able to show this to our patients, explain to the patients that this patient is a clincher and a grinder, and that's what's causing these restorations. I would submit to fracture like this. It's good information for the patient to have, because now this patient understands what we're up against, how we want to keep these implants in the bone because they've made a large investment, but that we are up against some challenges here. So when we get this biofilm and it matures, then we can get the mucositis, and that can progress in the peri-implantitis. And then if it progresses into the loss of the implant, that's not a good thing. So again, what we'd like to do is we'd like to detect this early. We'd like to inform our patients. And that white light image where we could see the plaque, our patients don't really appreciate what that plaque means at the gum line. And it's just hard if we're going to tell them, hey, we have to get you back. Maybe we're going to do surgery in that area to open that area up, clean the implants, maybe do some grafting, whatever protocols it is that you want to follow, it becomes very difficult. So in our office, what we try to do is we try to show the patients visually what's going on so that they have a better understanding. So we try to show it to them. So we see it, then we show it to them. Then if it's an area that maybe isn't that bad, what we can do is we can track it. We can give the patient some homework. What we want you to do is keep this area very clean, and we have some ways of doing that. Then we can track it over time to see if they're able to improve the health of that area of implants. So if not, then we can act on it. So the nice thing about using this technology is, again, it's going to show us more the mature biofilm. And then we have a chairside visual that we show the patient so they can immediately understand. So we've identified the risk, we've educated the patient. Now we have baseline images, and then over time we can compare the change. So on the bottom photos, again, you have implants, and where you see that red glow, we've got biofilm, we've got disease in that area. Patients have a hard time seeing it in the white light image, but with their red light image, they can see that red glow. They know that that's not good. So what do we do clinically? The workflow is very, very fast. It's not something that's going to take you a lot of time. What you're going to do is just identify the risk. If the patient has an implant, well, we want to check those implants very carefully, especially if they've had periodontal disease in the past. Why did they lose their natural teeth? Why did they need an implant? These patients come in, and as I showed you with the previous example, they have hygiene challenges. They're not getting in there to clean well around those implants. They could have other challenges like diabetes, other systemic issues. They could be smokers, which we know can maintain those implants even harder. So now we have a patient that's kind of high risk. They've got reasons for us to suspect that. What do we do now? We can dry that area off, take our camera in there, and we can maybe our pen go in there and capture the images, both the white light and capture the red light images. We can put these up on the screen now in front of the patient, and I can tell the patient, we can show you these areas that we're watching, that we're concerned about. So this is, let's say, the upper right area. This is an image. Wherever you see red, that's bad. That red area is mature bacteria, and that's what's causing the inflammation of your gums and the bone loss. And then we can figure out, okay, are they of low, moderate, or high concern based on all the information that we can gather. Maybe we do some probing. Maybe there's bleeding. We have our QBLISS images. And then we decide how to act. What is it that we're going to do? Let's say it's cleaning around the implants or the natural teeth. We're disrupting that biofilm. Well, if we disrupt the biofilm, what's going to prevent it from growing back within, a week, a month? So what kind of home routine are we going to give them? Are we going to shorten the time between their recare appointments? What kind of documentation are we going to have so we can show our patients if they're progressing in a positive direction or perhaps not? So again, this is an implant. On the left-hand side, the white light image, you can see that we can see the plaque around the gum line area. But it's very hard for the patients to really understand the importance of that. But with the red light, now you can see that red glow right around the gum line of that implant. And the patient can understand very fast that wherever that red is, that is where we don't have healthy tissue. So again, the low concern, if they're not at great risk, we might just keep an eye on them. If they're moderate, what we're going to do is debride that area. We'd adjust their home care regimen, re-image when they come back. We might have them on a very short recall to see how well they're doing with their home care, and then consider adjunctive therapy. We call it IRX in our office. If they're high concern, we see a lot of red, like we saw in the last examples, a lot of bleeding, separation coming out, deepening pockets or bony changes. Now we have to be a little bit more aggressive, and that's where we might recommend some surgical intervention to treat those areas. But the QBLISS is a very important adjunct to the whole peri-implant exam, how we're keeping track of the health around those implants, which again, our patients have made a very large investment in. So instead of saying, you need to clean better around the implants, patients don't really see any value of that. When we show them the images, we can tell the patient, hey, that red fluorescence tells us that biofilm is still very active in that area. And what we want to do is we want to protect your implants because you've made a large investment in that. And we don't want to start to lose bone around the implants, because if we start to lose bone, then the implants can fail over time. And if that disease state gets around the implants, unlike a tooth, are very difficult to treat. We've got the threads, which we can show them on the radiograph. We've got a surface that's a little bit rougher on purpose to help the bone integrate. So instead of blaming the patient or us taking the blame, we start to build a partnership between the patient. We see that we have the potential to develop a problem. We're going to help treat you in our office, but what I need to help your help with is at home, your home care. It's going to be very important for us. from vague instructions where you've got to clean bed around your implants. Now we give them a visible target. You know, when this image that you see on that screen right there where all that red is, that's in your upper right area. What I have to have you do is clean around these implants in that area very well. And what we're going to do is when we get you back in a few weeks, we're going to take new images to see if we have an improvement there. And instead of our patients feel like, hey, they're trying to sell me more treatment, they understand that no, what we're trying to do is we're trying to implement treatments to help protect those implants. And so what I'd recommend is don't say we need to get you back for root plane and scaling, but we need to get you back to provide you treatment to protect the implants, because now they understand the importance of them coming back. And what we try to do again is try to follow a very minimally invasive protocol. So how's the team work with this? Well, the hygienists, while they're doing their cleaning or getting in there, they might identify areas where they see that there's peri-implantitis. So they can go ahead and capture the images. So by the time the doctor gets in the room, we can diagnose the risk. Sometimes my assistants, like if I'm working on a patient, and so the patient's not in a hygiene appointment, but I'm working on the patient, the assistant can help us capture some images. If I see that there's some issues developing, and we can put images up side by side, or maybe over time show the patient where their tissues were 3 months ago and where they are today. And if it looks better, offer them encouragement. When the patient gets up to the front desk, again, the front desk should understand what we're trying to do. Not just say we need to schedule you back in 6 months, but we really need to see you back, Mrs. Patient, because we want to protect your implants. And what we see are some early signs that disease could occur around those implants. And we just want to help you prevent that from occurring. So again, as I was mentioning before, maybe instead of just saying we need to get you back for another cleaning, that we really need to emphasize to the patient that, hey, we're going to get you back to protect those implants. So we have this implant protection protocol or treatment that we want to render to prevent disease around those implants. And at least in the United States, because I know we have a global audience, in the US, this helps us create a healthier practice, right? Because the patients see a higher value in the services that they receive in our office, because we don't just show them, or maybe just give them a mirror. You know, that's probably the most rudimentary thing, is we give the patient a mirror and say, this is an area we have to have you treat. Some offices have intraoral cameras, so we can show the patient with a white light image, this is the area that we have to have you treat or take care of at home. But with the QBLISS, we're able to show not just the images of the implants, but the red glow that shows the activity of the biofilm. That helps us develop a stronger hygiene program, because again, we're now going to start telling the patient we need to protect your implants, not just clean your teeth. And in the US, our hygiene programs are a very critical part of a strong practice. We're going to have better case acceptance for whatever we recommend, because we can show the patients. So they're not having to trust us necessarily, but we can show them to build more trust. And as they build more trust, they're going to refer more of their friends and help us grow our practice. So we're providing that clinical value, but that clinical value using the QBLISS technology then helps us prevent disease, helps us document that, and helps us to get patients more likely to say yes. So as you implement this technology into practice, there's a little bit of adaptation that we have to make, changes within our practice that are minimal. But I know in our practice, whenever we have to implement any kind of change, it is difficult. So what I would do is, around the focus around implants, is I would develop some scripting. So again, you're not just telling the patients, we need to see you back for a cleaning. We need to get you back so that we can protect those implants. Develop a script, and then pick out those patients that have implants, whether they're healthy or disease. We're going to just get into the routine of talking to our patients and showing them what's going on. Then we have to get in the habit of taking some baseline images. Again, whether the implants are diseased or healthy, take the images, because if you have healthy images and maybe a year down the road we have disease beginning to occur, it's nice to be able to show the patients the before and afters. Create some pathways of treatment. Hey, everything looks good, so we're going to continue to watch it. This doesn't look so good, we need to get in there and treat it. Or this looks really bad, we're going to need to refer you out to specialists if you don't do any kind of the surgical retreatments. So remember that imaging of, if we go from a disease state to a non-disease state, that's good. Show the patients that. It encourages them because we have some early wins. And then track some of the metrics, the number of patients that you see, the percentage of patients that have peri-implant disease, the ones that we've been able to provide some intervention with. So the take-home message about this part is that peri-implant disease is very common and it's very quiet. It can be very expensive to treat, but the QBLISS gives us a way to visually see the biofilm and helps us communicate that to our patients very quickly. The workflows that I've shown you are very easy to implement. So what I would ask you to remember is, again, biofilm doesn't discriminate. Young and old, we can find biofilm in the kids with ortho, or we can see biofilm in our older adults that have the implants. And what we're doing is we're moving dentistry from that reactive mode to a more proactive one. And one of the most valuable tools to do this, whether it be implants or just a patient that has their natural teeth, is this QBLISS technology. Because with it, we're able to give our patients more control over their health. And the exams that we do with this technology, they're fast, they're affordable, they're comfortable, we're not probing, we're not poking. It's just light. It's just taking images from their mouth. So the last part of this, what I want to go over really quickly, is how we use this to build a high trust practice. So to prevent peri-implant disease, we are using custom-made trays called Peri-Protect. And what these trays do is they fit very tightly around the teeth, and they help to squeeze gels into the sulcus, and they help to squeeze gels in between the teeth. And so we use these trays for what we call biofilm modification. So the workflow is we show the patients what's going on in the mouth. We've got all this biofilm. And a lot of times I'll tell the patient, hey, practice really good oral hygiene. And when you come back in 6 months, we're going to take some new images and see if you've gotten any better. 6 months later, they come back and there's the red all over. And I just tell the patients, whether it be the natural teeth around the implants, we don't want disease to progress. Where that biofilm is, that red is in between the teeth, you're more likely to get decay. Where the biofilm is at the gum line, you're more likely to get gum disease or implant disease. And so what I recommend is we use these Peri-Protect trays, and we're going to put a gel in there. And one of the gels is a very low concentration of hydrogen peroxide that will control that biofilm. So it's all about modifying the biofilm to keep it in the symbiotic realm, not the dysbiotic. So we scan, we get the trays back in under 2 weeks, get the patient back and deliver the trays. Why the hydrogen peroxide? Because the hydrogen peroxide helps to keep the anaerobic bacteria under control because it's releasing oxygen. So again, what we're doing is we are adjusting the matrix and loosening up the extracellular polysaccharide matrix that's built up in this community of mature bacteria. It's a very low dosage. Hydrogen peroxide occurs naturally in the body, so there's really no chance of any kind of allergies. And these trays help push the hydrogen peroxide deeper into the pockets. How does it help our revenue? When our patients say yes, they're interested in Peri-Protect trays, the trays, the scan, the fabrication, and what we charge is $800. So again, it helps us because we're providing our patients with a very minimally invasive treatment, and it generates revenue. So what we're trying to do is we're not trying to kill all the bacteria, because remember, we have good biofilm and pathogenic biofilm, but what we're doing is we're changing the environment of that biofilm so we no longer have disease. And think of it as a diabetic. They take their insulin, but we have to control the sugar over time. A patient that has peri-implantitis, we may go in there and instrument around the implants to remove that pathogenic mature biofilm, but we need some kind of daily management. And that's what these trays are. They're to help to keep the gums healthy between visits. So in our practice, when I place an implant, I start using the gel with an Essex tray so that the soft tissues heal up nicely around the implants. And then we get our patients on these trays to prevent peri-implant disease. So the objective is to shift that microbiome and keep it in from a diseased microbiome to a healthy microbiome. And so that's what we're trying to do. So our workflow, again, if we implement all this, is we visit one, we detect the biofilm, we capture the images. We might debride that area, and once we debride that area, then we deliver the Peri-Protect trays, because now we've removed the dysbiotic biofilm, and now we're going to prevent that patient from going back into that state by using the daily hydrogen peroxide. And then we'll reevaluate them over time just to be sure that they're maintaining everything. But I talked about scripts earlier. A real easy script is: a healthy mouth contains billions of bacteria that live in balance with your body. When the balance is disturbed, the harmful bacteria begins to dominate. And that unhealthy state is called dysbiosis. That dysbiosis is what creates the inflammation of your gums, cavities, gum disease, and can affect your overall health. Our goal is not to remove all the bacteria, but to restore a healthy balance so your mouth can protect itself naturally. So what I've shown today is that we can identify the peri-implant disease because it is very prevalent. We use the QBLISS system to identify where that biofilm is, and it's going to identify that mature biofilm that's pathogenic. And then we, in our office, we use a very minimally invasive treatment to prevent that disease from progressing. And we use the Peri-Protect trays. And again, I know it's a global audience, so you may not have that type of tray available to you, but I just want to show what we're doing in the United States. So we talked about the incidence of the peri-implant disease, how we identify the biofilm and educate our patients very quickly, and then how we try, in our practice, we try to prevent peri-implant disease instead of waiting for it to occur. And those of you that are, again, from all over the globe, I really want to thank you for attending these programs. We want to give you some quick insights into how we're actually using this. It's something that our patients really appreciate. Our team really enjoys showing the patients. And for all of us, you know, we have this technology, but I think what's more important is that we develop a community of very like-minded individuals trying to do our best for our patients. And we know that a lot of disease today is preventable. And all we have to do is be able to show our patients where that disease is most likely to occur and use simple treatments to prevent the disease from maturing. So I just want to thank you. I know we go fairly quickly as we go through these programs, but we'll stay behind for the Q&A. But I just want to emphasize that QBLISS really makes you visibly different from other practices. And in the United States, like I think everywhere, and, you know, being in dentistry is kind of more competitive today. So we're always trying to find a way that patients will see more value in what we do in our practice. And I think the QBLISS technology does that very well. So just want to thank everybody.